What is up, group members, and happy Pride Month. I'm licensed psychologist Dr. J.
I'm licensed clinical social worker Kristen Gingrich.
I'm licensed clinical psychologist Dr. Kristen Casey.
And I'm licensed psychologist Dr. Jessica Rabon.
We are so stoked for this episode because a little later on, we're going to have on That Gay Doctor, who's going to answer all your thoughtful questions because we're talking about LGBTQ plus healthcare disparities. We got some stuff to sort out here, so settle in, take a seat, and welcome to Group Therapy. Last week, we explored the epidemic of loneliness and isolation. We also talked a lot about muffins and donuts. That's still ongoing. But we also asked you, how would you help a friend who's experiencing loneliness? And you said, send them memes.
Solid.
Okay, good.
I mean, that is a new love language. It's the sixth one just added. We love that. Just hang out and exist together for a bit.
I love that.
Call them and meet them for coffee. Who doesn't like a good stimulant? I mean, I know these three. Just look at their eyes.
This girl.
Just look at their eyes.
First of all, also, pot calling kettle.
I said who doesn't? Listen, I'm included here. I'm part of this group. We love those responses. We don't love disparities when it comes to healthcare impacting LGBTQ plus. So let's get into them. Let's start this discussion. Where should we begin?
There's so much.
Yeah, I mean, I feel like maybe just highlighting some of the known health disparities would be a good place to start. Well, from a mental health perspective, we know that individuals who identify as LGBTQ plus have higher rates of depression, anxiety, other mood disorders, increased risk for suicide, self-injury, alcohol use, drug and tobacco use, things like that. And with regard to like physical disparities, higher rates of obesity, cardiovascular disease, cancer, disability, even things like respiratory diseases, asthma, gastrointestinal problems. And I'm sure we'll get into this, especially with That Gay Doctor later, but there's also a number of healthcare disparities as well.
Mm-hmm. Yeah, I tend to think of the healthcare disparities because when I provide therapy for people, a lot of times they'll say to me, like, I've been searching for a therapist for so long who's gender affirming, or I've been searching for a therapist who really sees me or who isn't going to judge me. And some people had been searching for like months, you know what I mean? And I think it's really hard because I think there's an element, and I'll just speak for myself as a bisexual woman, like there's an element of like a lack of safety that you might feel when you go to the doctor or when you reach out to any provider, for your mental or physical health. You just hope that they see you.
Something that you said, K10, that, I mean, I think we all know what it means, but, maybe some of our listeners, but that term gender affirming care, it gets thrown around a lot. And so I was wondering, what does that mean?
Do you want to take this one, K10? Or do you want me? I don't know.
I was going to say, I was
looking right at Jess.
Yes, because I know Jess has been making so much content around this too. I'm pretty sure you just made a reel today about it.
I don't mind answering, but I think Jess would be more eloquent. So you take the floor.
So there are a lot of aspects to gender affirming care. The things that people think about the most are medications and surgeries. So puberty blockers for individuals that are just starting puberty. You have to be in Tanner stage 2 to start puberty blockers, hormones such as testosterone, estrogen, and then gender affirming surgery. So that could be implantation of breasts, removal of breasts, vaginoplasty, phalloplasty. But what people don't realize is that gender affirming care is so much more than that. So it's the psychoeducation around not only interventions, but, what it means to exist in, for example, I live in the South. What does it mean for you to be out? What are the risks, benefits, safety concerns, things like that? I work with a lot of youth, educating families, using correct name and pronouns at the most basic level. That's what gender affirming care is. Providing resources to maybe local support groups or LGBTQ plus, we have youth groups here in my area, or for parents, LGBTQ plus groups that can help them connect with other parents of LGBTQ plus children. It's exploring identity. It's providing a safe space to do so. Things that people don't think about a lot that I always like to throw out: birth control is gender affirming.
Yes.
So for people that get their period, if they don't want a period, speech therapy can be gender affirming to help increase the pitch, decrease. Laser hair removal can be gender affirming. Fertility preservation, so saving eggs or sperm. I will pause there, but that's it at the basic. And at K10, you can add anything that you think of.
Yeah, I do gender affirming surgery evaluations. And it's so interesting to me when I think about this topic, because when I think of someone who, is just going for plastic surgery, right? Just say we might call it top surgery for people who are trying to get implantation or something like that. For someone like me who's maybe not trans, I could go to a plastic surgeon and I don't have to worry about a letter. I don't have to worry about anything else. I just kind of go and get the surgery, right? For my clients who are getting top surgery because of gender reasons, in terms of their care, they need all of these letters, and it's a real long process. People might have to be in therapy depending on the psychologist and, their thoughts on it. They have to be on HRT. There's all these things that are needed. And I think there's such a disparity, with that, because usually when we provide these evaluations and we're just evaluating basically how will you care for yourself after surgery. There's an emotional process that happens when you get plastic surgery or when you get surgery in general. How you care for yourself, how do you deal with the big changes emotionally? And that's with any surgery, if you really think about it. Things are going to change and you're going to feel different, but for some reason, it's just so stigmatized, I could go out and get a breast augmentation and not have to worry about any letters, and I just think I like to say that out loud. And I was really hoping to say that on the podcast today, because I think that there's this preconceived notion that people who are, non-binary or trans or something like that, they have to almost, find somebody who's going to be gender affirming, somebody who's going to really see them. It's a really difficult process in my mind that shouldn't be that difficult.
And for those individuals who are trying to do that, that must be exhausting.
Oh my God, yeah. Can you imagine?
And the impact. And Jess, you touched upon this, right? Individuals in the LGBTQ plus community are at higher risk for things like depression, anxiety, things like that. And I can't imagine just trying to receive gender affirming care, how that impacts that on the other end as well. And it actually increases those symptoms.
Totally. Especially, I know I stumbled upon some data that was 1 in 10 LGBTQ plus people reported being denied by a healthcare provider in the last year. But that number is 3 in 10 for trans people. And that was back in 2017. When you think, especially in data and research, 30%, 10%, these are whopping numbers compared to something like anxiety, something in the mental health context, it would be wow, 5% is a lot. 30% were denied by a medical provider. And there's part of me thinking that data was collected in 2017. And now with all different legislation coming out in 2023, it's scary to me, especially knowing both the American Academy of Pediatrics and the American Medical Association fully support gender affirming care.
Yeah.
And this is where, for me, it's it is entirely unscientific to not. But again, I know a lot of people don't care about science and data, but literally should.
We do. We do.
Yeah. Yeah. I mean, even for 3 of us are psychologists, I could speak from the APA, not the APA ethics code, but just the APA in general. They're all for it. Hey, provide care, right? But then we're up against legislation, which I know we'll get to at some point, saying we can't provide, I'm dealing with that right now. We can't provide services for people in certain states, based on their age or based on certain things. I just think it's wild how even doctors or professionals are having to go against their own ethical and even moral code and trying to even help increase access to care. It's wild to me. It's just, I could go off. I'm just going to stop myself.
Well, and we think of access to care, and K10, you said something a few moments ago about, the safety. And, we have legislation that is banning gender affirming care, particularly for youth. But outside of that, a lot of individuals, and there's a lot of research on this, that are LGBTQ plus delay their health care or avoid getting health care because they are worried about how a provider is going to respond to them. Our healthcare system is very heteronormative. Like, I don't know how many times maybe you all have gone to the doctor, or like I've heard from people that a physician or whoever they're meeting with, if they ask if you're sexually active, assume you're in a heterosexual relationship. Yeah. Especially as individuals that can get pregnant, what are you doing to prevent pregnancy? It's an assumption that you are with a partner who can get you pregnant. So when I think of like the physical health disparities, if they're delaying care because they don't feel safe, or they live in a rural area and there is not providers that are trained in LGBTQ plus health, they're not going to access care, or the care they're going to get is subpar, or the fear of being denied care. And then when we think of the mental health disparities, one thing I hate hearing, and I feel like I hear it less now, is that, people that are LGBTQ plus have higher rates because they are gay, bi, trans, etc. But just look at our socio-political climate. Look at the discrimination. Like, wouldn't you be depressed and anxious too if you turn on the news? Exactly. If you turn on the news and everything is, legislation against people like you, you see harassment, all of those things.
Yeah, especially when we have that data too, that individuals who are LGBTQ plus are far more likely to be bullied, harassed, and rejected. And I think a lot of cis privileged white people, they have limited experiences with that. Like, very limited. And they probably remember the few instances that even occurred. But all it takes is one experience to feel rejected, to feel bullied. And then, yes, you don't feel worthy enough to talk about these things openly anymore. We know this as therapists, as psychologists, that it doesn't take much for someone to start internalizing and feeling ashamed. And then all of a sudden they're hiding their truth. And it leads to depression. It leads to anxiety. But it doesn't take but a few instances of that for that to occur. And we have the data that that's happening all the time in school systems, and of course, certain states in particular.
Oh, yeah. And with that, right, the increase of, depression, anxiety, I think I literally just saw this, that it just came out that suicide is the second leading cause of death for individuals in the LGBTQ plus community. I think I just saw that. Yeah. I might have to double check, but that's.
Yeah. And I mean, this is why people stay closeted for so long, because it just feels so unsafe to not even just be yourself, but to just acknowledge something. I'll just speak from personal experience, like acknowledge something that you seemingly don't have a choice over. You know what I mean? Like for me, I was like not really out for a long time, even around my own friends and family, because it was just knowing their thought process or how they might view me, or they might not take me seriously, or they might think, all these stereotypes that they might have. When in reality, I noticed that for a lot of my straight, cis, especially white friends, they've never had to question, like, who do I love? You know what I mean? So for them, it's just an automatic thing, which is a beautiful thing, to really have a decisiveness and a knowing of really who your preferences for a partner are. But I think for some of us, we don't have that luxury of really saying like, oh, without a doubt, this is how I feel, and I could actually be open about it. And not even that, but people will celebrate that for me. It's just, it's so hard, I think.
KBI, I did fact check, and you are correct. Suicide is the second leading cause of death among LGBTQ plus youth.
Crushed it.
Yeah, I saw that. I just saw it. It was going around on Instagram, and I had just seen that, and I was just like, just sitting and going to K10, like what you said, where like feeling like you have the people to talk about. I know it's also been said that a youth who is in the LGBTQ plus community, if they have at least one person who sees them, accepts them, loves them, uses their pronouns, their name, all of that, that is a protective factor for that individual. Just one person in their life that means something to them in like their immediate circle. Like just one. That's all, like one.
Which highlights why legislation, like in Florida with the Don't Say Gay bill, is so damning and harmful. Which originally was proposed of like, it's just about protecting children. And then it was expanded through high school, and then the bans have kept coming since then. So we know that certainly isn't true. But for someone to just model open conversation, and maybe they're queer themselves, to be able to model, this is my life. I have a wife at home or a partner, and to be able to talk openly about those things, it models your existence, which again, the extreme notions have always been put forth of like, these are why certain bans are out there, because children shouldn't be exposed to sexual things. But we know so much heteronormity happens all the time where teachers are like, oh, me and the wife did this or that. That's happening all the time.
Oh my God, yeah.
And so to be able to be open and be talking about anything under the LGBTQ plus and identify as that and model that is so important for youth. But of course, it's been taken to extremes of like, you're teaching children about sex. I always say, where is that happening? Find me where that's happening in the school system. It's not happening. And that's not what it's about. We know what this is about.
Yeah. And I was just going to say, Justin, thank you for bringing that up, because if we do think about actual sex education in the United States, now granted, it varies to state, and like there's certain states that are still abstinence only, things like that. But most states, vast majority, if not all, don't include queer sex and sex education. So if we're thinking about health care, health disparities, and I know that gay doctor will probably talk about this later, if we're not including queer sex and sex education, we already know sex education is not great in the United States, but that's going to put these individuals at higher risk of possibly getting sexually transmitted infections and things like that. Or also from a mental health standpoint, like shame around it. Because, okay, this was never taught to me. I don't know what to do or how to approach a partner or things like that.
What to expect or what consent looks like. I mean, it's like, it's so deep, And I mean, you'll make such great points, because I think when you're reading a book or you're in a class and the content or just the books themselves aren't made with you in mind, you inherently feel like you don't belong. And when you feel like you don't belong, you feel like, the shame and, oh my God, am I making a mistake? Or maybe I'm questioning myself. Like, is this real? And it's just, it's really weird, because I think a lot of people do have heteronormative blinders on. Like Justin was saying, they might talk about their own sex life, or they might even ask like younger kids, like, oh, when are you going to have a boyfriend or a girlfriend? Which is super cute and endearing if you think about it. And deep down inside, you don't realize that even that, could put somebody in a situation where they're like, oh my gosh, we can't talk about sex. It's like you're talking about relationships and all that stuff with kids. Just from a heteronormative standpoint, it's no different. There's just an inherent bias that people have towards the LGBTQ community by not talking about it and actually, like, I don't know, demonizing it sounds like the wrong word, but like, making it seem like it's wrong.
Absolutely. So one question I wanted to pose to you all, because obviously we've just scratched the surface on a number of health, mental health disparities, access to care. Why don't you think it's talked about? And why do you think it is important that people do actually talk about the disparities?
I think it's like one of those things, right? We talk about it, it brings awareness. And when we have awareness, we can't deny that those things exist. And when we know that those things exist, we can attempt to make the change that needs to happen to lessen those disparities and to make them less impactful, hopefully to make them non-existent. The goal is to make those to make those disparities non-existent so that individuals can access the health care that they so desperately need, whether it's healthcare, mental health, whatever that may be.
Yeah. And it saves lives too, because I can't tell you how many people I talk to that are like, I wish, like you were saying, KBI, like I wish I had that one person, or I just wish that it was talked about more when I was younger, because if it was talked about more when I was younger, then maybe I would feel compelled to ask questions. And when people ask questions, they get curious about their health and their mental health, and then they actually keep themselves safe, you know? And I think the whole point is that if you don't feel like you have the information or the knowledge to know how to proceed, then inherently you're going to make mistakes, or you're not going to really know. And you might actually think that something's okay when it's not, or vice versa, you know? And I think the more that we do talk about it, I don't know, knowledge is power. And if it makes people feel less alone and like, I don't know, like more secure with their choices about partners, sex, anything like that going forward. And I know I'm talking a lot about sex, but I think about STIs and all that stuff. I just think it helps so much, because there's so much, I guess I just see it from a different lens because I'm bi. Like everything is so heteronormative. It's like, it's wild to me. Like the lens in which I view the world could be so different than someone who's cis het straight. You know what I mean? Like it's just so different. And some people might not realize that they're seeing it from that standpoint. But the more that you include people, it doesn't make anybody else feel less than. You're just including more people in the mix, which I think could be helpful.
Absolutely. And I think of what we model in psychotherapy. We model curiosity, we model safety, we model exploration of all kinds. All kinds are welcome. But then I think about that is like, if no one has modeled that for you, and there's active bans, restrictions in place that tell you what you might be experiencing is wrong or should be limited, how would that not equate to feeling worse about yourself or limiting your mental health or capacity to discuss it? This is true with anything. Like if someone can internalize that this is true with mental health globally, like I think most people could digest that and understand, like if you haven't been modeled to talk openly about your emotions, your feelings, these things, but then again, your state is actively banning identities that resonate with you, that feels like this is who I am. How would you feel compelled to talk about it and feel good? So when KBI drops the disheartening stat that suicide is the second leading cause of death, how is that surprising? And I feel like, again, it all relates back to these politics.
And I think you guys could probably speak on this more so than me, notably KBI and Jess. I've heard you talk about it before, but even just the concept of like suicide as an analogy, the more that you talk about suicide, it doesn't necessarily mean that somebody has a higher likelihood of completing suicide, right? It just creates space for them to explore and to even talk about that. And I find it to be similar with people in this community. I mean, the more that you talk about it, the easier it gets. And it's not going to, like, the more that you talk about it, it's not going to turn people gay. You know what I mean? Like, it's just like, you just want to be open and be able to talk about it, you know? But I could be wrong.
And it definitely, like, we want to create that space, because a lot of the time with individuals that I have talked with, had conversations with other providers, is, you know, a lot of times individuals contemplate suicide because they don't see an end in sight. And so for LGBTQ individuals, they truly don't feel like there's an end in sight because they don't have the access to the care, and they don't feel like the care is going to be there. They don't feel like the world is going to shift or their environment is going to shift. And so then you add that additional layer, which causes the increase in suicidality in that community.
Absolutely. Another question that just came to mind, Justin, when you were talking about like what we model in therapy, how many of y'all were actually like in grad school taught how to work with LGBTQ plus individuals, or taught about like how to provide gender affirming psychotherapy, the health disparities?
I wouldn't say specifically. Not specifically. I mean, we were taught our code of ethics and what that means as far as different populations, but we were not trained specifically to work in those populations.
Interesting. Yeah, there was no like class. And my cohort members, if you listen to this, correct me if I'm wrong. I don't think that there was a specific class. I remember one professor was very open about talking about this stuff, but I didn't really learn much about it until I got on my internship when I was at the VA. So in grad school, in terms of like classes and stuff, not so much, but in clinical roles and in clinical experiences, I had a lot of guidance there.
I literally was going to echo the same. I'm like, it wasn't really until internship and beyond. I think that's also a strike against this generalized cram it in training that we get, where it's like, how many different things were crammed into your multicultural course?
Oh my God.
Absolutely. Yes.
There should have been one class per like quarter or semester about that, like literally.
The nuance of diversity, cultural inclusion. Yes, that could have been a course we took every single semester or quarter, but most of us took it once, one semester. And I had great supervisors who modeled this, had great ongoing discussion, talked about that frame and all those things, but nuance training, no, it wasn't until I was near the end of the road.
Yeah. And I'm the same. It was really internship. I mean, I had, my cultural competency class, and then, in our lab, we did LGBTQ plus health research. So I got more there, but formal training. But the reason I also brought that up, thinking more broadly of like healthcare, I can speak just at least to the hospital I work in. That is something I hear a lot from residents, med students, physicians. They're like, we weren't trained in LGBTQ plus health. My hospital does now require an annual LGBTQ plus health, we call them CPTs, but like training that we have to do, like along with like hazardous material and, harassment in the workplace, which I'm glad, but it's like very, very basic. And I know one thing I've heard from a lot of physicians I work with, because I feel like a lot are pretty open with me because I work with this population so much, is like, I'm scared of saying the wrong thing, or I'm scared of like offending. So because of that, they kind of shift the other way, whether it's not, even if it's not like blatant refusal of care, but it's avoiding talking about gender identity, sexual orientation, asking about partners that is not in a heteronormative way. But by avoiding the subject, then you're reinforcing the narrative that this is not a safe place to talk about these things.
So true.
Well, and
that is so true. Go ahead, Kavia.
Well, it is. And again, if all of your training is just 1 hour a year and it's the same training, and it's just, here's a quick reminder. Like, I remember, at my old job, right? A lot of mental health facilities were supposed to be trauma informed, right? Except on our intake forms, it says gender. That's the only option it's gender and your name. And so I did a big push with my previous job, and I said, this needs to change. I understand per insurance, we have to have certain things on there so it aligns with the insurance, but there's no reason why we can't be asking individuals for their pronouns. Why we can't ask them for their preferred name, because even if comes in and wants to be called Nick. And so being able to, and then just to be able to open up those conversations just immediately, but also that person coming in that door. If I have someone coming in that door who has he, him on, or they, them on that intake form, those are the pronouns I'm going to use. And for someone to come in who might be trans or gender fluid or non-binary, to be greeted with the pronouns that they use, starts off like just right there is gender affirming.
And you create safety that way. You basically say, I see you. And I think to Jess's point too, I think for providers who are nervous, about feeling like, oh my God, this feels clunky for me, I don't really know what to do. There's a learning curve, of course, with anything, right? So, early on in my career, I would ask for pronouns, but I wouldn't give mine. And I had to finesse that a little bit, right? So you create an element of safety when you also give your pronouns, right? So asking for pronouns is a great first step. And then also providing yours in exchange to almost normalize that conversation. And when you're just starting out learning about this stuff, I know that people feel this sense of like fragility, like they don't want to do the wrong thing, but the worst thing you could possibly do in my mind is not address it at all, and not have a curiosity or an interest to learn more. And I think that's the whole thing about like cultural competence, right? You're never going to get to a point where you're completely like culturally competent in every area. It's just not possible, in my opinion, as like a white person, right? So that's the same with LGBTQ health stuff. You're never going to know everything, and that's okay, but allow people to correct you. Be okay with making mistakes. It's okay.
And I love that you brought up, asking pronouns, introducing yourself with yours, because I know like there are other ways that we can communicate that our space, whether we're a therapist, psychologist, other healthcare provider, is a safe place. So like even, in the hospital, a lot of the residents, I see wear like pronoun pins or a pride flag or other things just like on their ID badge that indicates that they're a safe person, having like a safe zone sticker, or even like having materials in your office that don't just show cishet individuals, all gender bathrooms, like those like quote unquote little things can really, really communicate to people like, oh, this is a safe place. I've definitely had clients that I was not seeing for anything related to LGBTQ plus health come out to me and say it's because I have things in my office that indicate it's a safe space. So you don't have to, yes, you want education and training, but it can also be those like smaller things that can really make a big impact that shows that you are a safe person.
Oh yeah. A really funny story really quick. In my partner's office, there was 2 bathrooms, like men and women. And I went in there and I pulled those off and I just got a scented restroom. And I put them on both beds. It was so fun. I was like, I felt so sneaky. I'm like, I'm a snake. And it was like really cute. And I was telling him about it and he's like, we had that open conversation and he's like, I totally get it. And like, thank you, for making that a big thing. And he's like, because sometimes like I'll go in the women's restroom, like not like it's a single stall, by the way. Yeah. And he's like, cause I'm just passing by, but like, I want people to feel comfortable. Like they don't have to just use one. And if you don't identify that way, it's whatever. But I felt so sneaky. I was like, let's do it.
I love that story.
Yeah.
So
you know what else?
What?
I was going to say,
you're going to say
love.
What else we love? The Google Scholar shorts. You can do it.
You know what else we love? No, I'm kidding. You go. I'm muting myself.
So we've highlighted a lot of health and healthcare disparities between LGBTQ plus and non-LGBTQ plus individuals. However, I also wanted to highlight some intersectionality between race and ethnicity and LGBTQ plus status, because that's something that we have not talked about. So the article that I'm going to be talking about specifically looks at sexual minority women and discriminatory healthcare experiences and looks at the intersectionality between sexual orientation and race. So what this study found, it was a 2023 study, found that 22.9% of sexual minority women reported they experienced some form of identity-based discrimination during their last medical appointment. So almost 1/4 in their last medical appointment, with discrimination due to gender and sexual orientation being the most common forms of discrimination. Among sexual minority women of color, 33.2% reported experiencing discrimination during their last medical appointment, with language and race-based discrimination being the most common. In contrast, only 18.6% of white sexual minority women experience discrimination. And then if we look at racial ethnic discrimination among sexual minority women, in this study, Asian sexual minority women reported the most frequent occurrence of discrimination, followed by Native American, Black, and Hispanic, with white reporting the least amount. So findings of the study really highlight the frequency of discrimination during medical care for sexual minority women overall, and then the disproportionate prevalence of the discrimination towards women of color specifically.
That is just so crazy to me, because I think about like like just with like a white lens. Like I go into a doctor's office and I don't like think about those things, you know? And for my friends who are, you know, people of color, they have to think about all of these things, you know, and it's just on top of, you know, are they going to see me for my sexuality or gender? You know, are they going to ask me questions that are not affirming? Or are they going to assume things, you know, and then on top of the assumptions about, you know, who they are as people based on race or ethnicity. It's tough.
No, it's not tough. The poll questions.
Your transitions suck this
It's such, I think it's a hard topic. It's just a hard,
It is.
It's a topic that needs to be talked about, but I think it's like, you know, it's eye-opening, and it's just sad that we live in a world where people do not have access to just the same healthcare, and in general, like same access, same, you know, treatment, all of that.
Yeah, and exactly what you had said, K10, as well. It's like the only way forward is for people that own a lot of unearned privilege like myself to self-reflect.
Yeah.
Do the research, absorb the data, and think about your own actions. Like that's the only path forward to change. But the problem is, whether it's in your formal training or people just don't even realize the own privileges that they carry, it's not happening fast enough. The change isn't. But I know when you put that data out there, it's crushing. Like it's disheartening. Like it saddens me. And then it does. It leads me to a reflective spot of like, how am I being? But to me, that's the only path forward to change.
Oh, absolutely.
I agree.
You know what never changes though? The polls.
Them polls, baby. Let's roll.
I think they kind of change.
We tried
A little bit.
Our love for the polls.
Our love for the
Okay,
polls.
you're right. That unwavering.
Unwavering. It's unconditional.
Unconditional positive regard.
Except that I don't apparently have that towards muffins.
No, you don't.
Parts of them. Okay, so let's look. So the first question that I asked everybody this week is, do you consider yourself part of the LGBTQ plus community? It was either yes, no, or I'm still figuring it out.
Now's your time to come out. Any three of you. I'm kidding. I'm joking. I'm going to say 70. No, I'm kidding. I'm going to say, wishful thinking, 40.
Yo, swear on my
Stop.
life, I was literally about to be like 40. Like
It feels right.
It feels right. It does.
I'll go 42 just so we're all at the same number. So we're either all wrong or all right because we're all in this together.
So, yes, they do consider themselves is 35%.
Okay.
No is 48%. And I'm still figuring out is 16.
Okay.
Yeah.
Nice.
Love
that.
Got some explorers
Love that.
out there.
Love that.
The next one is, there are health disparities that are documented in the LGBTQ plus community. True or false?
True. I think our group members definitely knew this one.
I bet that's like 99.
98% say true. Okay. 2%
Yeah.
say false.
Wow.
Suicide rates in reported LGBTQ plus individuals are how much more likely than heterosexual individuals? 2%, 4%, 6%. No, oh God.
Times.
2 times, 4 times, 6 times, or 8 times.
Oh. I'm trying to do math in my head and I just can't.
I think the majority are going to say 6 times.
Yeah.
I think it's 4, but 2 for you.
I was going to say
but
4.
Now I am questioning my brain.
I'll go 4.
So
I'll go 4.
so it is 4 times.
Okay.
And it was 44%. I also want to just put out there that this is what is reported. So this does not count
Smart.
individuals who may be in the LGBTQ plus community or questioning their sexuality who have not disclosed to their families or anybody who would be answering those questions.
Good call, KBI. Yeah.
So yeah, I would imagine too that that number might be a little bit higher.
Yeah.
Sadly, 8% said 2, 33% said 6, and 15% said 8 times. Have you ever experienced healthcare discrimination based on your sexual orientation or gender identity? Yes, no, or I'm not sure.
Yes, at 40.
Yeah, that's a good guess.
I think no is going to be the majority just based off of what percentage said they are. I don't know. I'm going to say no is the majority.
So no was the majority with 59, with yes being 21%, and I'm not sure being 19.
Wow.
Oh, wow. Okay. Maybe we got some people to like reflect on have they not? Are they just
Right.
No?
The transgender community shows that up to blank percent of all transgender people face some type of harassment or discrimination when seeking routine health care. 24%, 39%, 57%, or 82%.
I want to say 82.
We kind of
But
already
I
answered
don't know.
these.
What was that?
Yeah. I feel like our group members are going to say 82. That was going to be my gut.
Yeah.
Yes. The majority said 82%, but it is 39%.
Interesting.
So 39% of all transgender people face some type of harassment or discrimination. 2% said 24, 15% said 39, 39% said 57, with 44% at 82.
So KBI, going back to something you just said about the suicide rates, I'm also wondering too, from that data, are these people that are open to their healthcare provider about being trans?
Have they disclosed?
And does that determine if they face discrimination versus maybe somebody that's not openly trans? I don't know, just a thought.
No, that's a good thought. Yeah.
Men who have sex with men are at higher risk for STIs than other populations. True or false?
True.
It is true. 37% did say true, with 63% saying false.
Wow.
Oh, interesting.
Yeah.
Talk about a plot twist. Yeah.
And there's lots of
got me thinking.
which I can't, obviously my brain completely went blank. But there's lots of data out there that show that men who have sex with other men have an increased risk of STIs. So, but that's actually one of the interest areas of sexual health that gay doctor, that's one of his interest areas.
I'm so excited to hear his thoughts.
I know.
He might be able to say more on that. I'm just reflecting. That's interesting. I do know, and I don't have it pulled up. I can look. There was something I saw on social media, and I did look it up, about like the cis het men have like, and I can't remember what year it was, like in the past year, had the most new diagnoses of HIV. So I wonder if people had seen that. So, and
Oh, I see what you mean.
like, and thought, so maybe this is false, but we do. Men who have sex with men can now donate blood, which is great since it's 2023.
So amazing. It took so long to get here. Oh my gosh. Yeah.
Well, it just always like they screen it all they screen it.
Oh, I know.
Yeah.
And so it always blew my mind that like, what?
Yeah.
I just don't know how people want to give blood.
Yo,
We had, guys,
not that I wanted to like say
we
that.
had this
but-
conversation months ago where both K10 and Dr. J almost passed out on camera. So
Was
I literally was
that was
like
our fears and
doing
phobia
things.
episode.
Yeah.
yes, it was. What was that? Like episode 3?
That was so long ago.
It was like Halloween time. So yeah, it was one of the first ones.
Yeah. And for the record, donating blood is a beautiful thing.
It's
Don't let me
great.
dissuade you. It's
Except
incredible.
K-
And
maybe K10 will not be doing it.
Yeah,
I would have to be put under.
Yes, you
But then
should
again,
do
there's
it,
a needle.
though. You should.
You
But
should. Yeah, you should.
For me, I'll try to give back to the world in other ways.
Yeah. I'm like, can't they prick my finger and just get it all that way? Like, I just can't. Like, I don't know
No.
what it is. Anyway,
You just
I
lay
can't.
down. Every
No.
time I've given it, I just have to lay down. Otherwise, I pass
No.
out. But
Yeah, lay down, take a nap. Pass out, take a nap.
I'm gonna take a nap right here while I gotta stop.
Yeah.
You're gonna tell me that's relaxing? No.
if you're lying down, it's fine.
Yeah.
I never
It's like,
said it was relaxing, but if you pass out, you're not.
Yeah.
You feel worse.
I don't
if
know.
You
I don't
pass
know about
out.
you, but like, yeah, like I get the spins though.
Yeah.
Have you ever like
That's
got
why
like
you
the
lie
whole room
down.
is spinning? Yeah, but it still spins. I'm still rocking and rolling. Like, it's like, whoa.
The last time I did like 6 vials of blood just for a routine checkup, and I literally woke up to smelling salts. So if you don't know what it's like,
I've been there.
Listen, I want to hear you being like, just lie down. You know how comfortable those smelling salts are.
They burn. Yeah. I recently, have you ever had to get an IV through an ultrasound because I couldn't find a vein?
No.
It is so painful because they put the ultrasound on your arm and they like go deep for, I was like,
Justin's going to pass out.
Oh my God. It was for like a medical procedure like I had a couple weeks ago, and she's like, then they're talking out loud about, I'm not going to say it.
Justin's like, stop.
We're good.
He wants to be here for our guest, and he's about to pass out.
Justin's room is spinning.
I'm spinning. Am I real? Like, literally. Like.
All right, everyone. We are so stoked to have on our next guest. Dr. John is a primary care provider in Chicago. He makes content for social media that shows that doctors are people too and normalizes them having a life outside of the office. His content is a mix between thoughtful, educational, and relatable funny around things we all experience in the doctor's office. Give him a follow if you're not already. He is That Gay Doctor. Welcome to the group.
Hey, thanks for having me.
Of course. So for those that know, they know, but for the ones that don't. What are you a doctor of, and what got you interested in sharing that with social media?
Yeah, so I did my training in family medicine. So I practice primary care on the south side of Chicago. I work at something called an FQHC, which stands for Federally Qualified Health Center, which is basically about meeting patients in their neighborhood and meeting their needs. And so we try to provide things like partnerships with food banks, with social work services, with discounted costs for uninsured patients, and things of that nature. And I accidentally kind of became a content creator. It was like never a goal of mine. I downloaded TikTok like 6 weeks before COVID started, and I think my first post was like a Cardi B voiceover or something ridiculous. And like it immediately got like over 1 million views. Like it was just like something silly about like doing a pap smear, and I was like, oh, and I was like, yeah, and I was like, yeah, like about with Cardi just being dumb, and it blew up. And then I posted a few other ones that like didn't do that well, and then one of my like 4th or 5th posts also got 1 million, and so like followers just started like trickling in, and I like very quickly had like thousands of followers when like that had never been a thing. And then once I had people listening, I was like, why don't I use this to actually say something meaningful if people are listening? And so just started doing kind of little educational bits about how to talk to your doctor, or kind of tips and tricks for both providers and patients, and it kind of gained traction, and here we are now.
I love
awesome.
that, because that's why I followed you in the first place, because I loved that everything was just so relatable. Even talking about like, you even made the things that sometimes we even feel weird about talking with our doctors, like you made it seem so easy, and like, hey guys, it's not that serious to talk about, what's going on downstairs.
Really?
It's, like, that's what we're here for. Mm-hmm. And so that's what I so much loved about your content. But I also really loved kind of like, as all three of us are here in the mental health space, you really just normalizing as well. Like, yes, I'm a doctor and I got these degrees and I got these licenses, but I'm also a human. And what has that been like on social media? Like, because I know like, I see your videos when you go to like festivals and stuff like that. And so, yeah, what has that been like for you?
Yeah, I mean, like, there's always going to be haters, regardless. Like when you have a following of a big amount of people, there's always going to be people saying this is unprofessional, or I wouldn't see a doctor that acted like this, and blah blah blah. And it is what it is, but I have definitely made like a firm stance on it, and am so done away with people saying that like you have to act professional in every aspect of your life, because our jobs are not our entirety. And so, yeah, regardless of what I post, like if I post anything resembling like a normal life, people will always comment, like, or if there's a swear word in my post or something of that nature, people always have to say, like, I wouldn't see a doctor that acts like this or something like that. And you know what? That's fine, because not every doctor is the right doctor for every person. And if you are looking for a buttoned up 50-year-old man that is going to talk to you down to you, then you are more than welcome to seek care with that person. And that person is not me. And I can recognize that. And I think like our generation is looking for someone that's just a normal guy that knows more things, and they can talk to them about their health. And so I'm very happy with taking care of people that feel comfortable with me. And if you're not, then you are more than welcome to establish care elsewhere.
I love that.
I love that so much.
Which is just why I followed you in the first place.
Yeah. And you talk about a lot of different topics on social media, and you said you're family medicine, a federally qualified healthcare center. Like, are there certain topics you are super passionate about, certain populations you love working with? Because you have so much educational content, but I just wanted to give you an opportunity if there are things that you're really passionate about or interested in with regard to healthcare.
Yeah, I think like sexual health is definitely like something that I really enjoy talking about. I think for the reason that a lot of people just feel so uncomfy and icky talking about it, and I don't at all. And I think that makes like a world of a difference when I can see the patient like stumbling over the words or like avoiding saying like penis or vagina, and they're just like can't make eye contact and stuff. And I'll just immediately be like, this is what you want to say, right? Like, or even sharing things like, if someone comes in for an STI and is like super upset, like I'm comfortable saying I've had an STI before. It's okay. Like we can do this. And that's honestly something that in med school they teach you, like, don't share personal things about yourself like that. That's kind of like, you're not supposed to do that. But I disagree, you know, like I think like people feel immediately so much more comfortable when I'm like, this is normal. These things happen. We're going to get through it, and it's not a big deal. So yeah, I try to do a lot of education on my platform about sexual health stuff, because I think it's kind of taboo for a lot of people. And the more we can spread that messaging about sexual health and normalizing getting tested and normalize talking about sex, the better for everybody.
I love that. I think, like you said, self-disclosure could be such a powerful tool, especially when people struggle, like to open up and talk about things. You know, it's just, if my provider was telling me like, oh, I've been there, it's like, okay, cool. I feel safe now. I can talk about this stuff.
100%. Yeah.
But let's get to the member questions. I'm like so excited. So we're so happy to have you here. So thanks again for your time. I know we're all really busy, so we just really appreciate you popping in with us. But the first one is from Kendra from Utah. She mentioned, can you give us some ideas for resources for parents who have kids within the LGBTQ population?
Yeah. I would say like my go-to for parents or children themselves is the Trevor Project website. It's like a really great starting place. It is broken down by topic. It has like go-to guide about speaking to a transgender person, and all like it's overwhelming the number of resources they have. It's reliable. They have such a good message. So that's kind of where I generally steer people to. And then they have, of course, like links embedded that you can, there's a world of information out there, but that's a great starting point for sure.
Yeah, I love the Trevor Project. It's so great too, because I think I don't even know when the Trevor Project started, but I just recently learned about it, and it's incredible.
It's amazing. Yeah. They had like reached out to me about like wanting to do like a post one time, and like talking about like sports sponsorship, and I was like, I'll post for free. Like I don't like I'm obsessed with you. Like literally, I don't even bother. Like
fangirling over the Trevor Project. I would do the same thing. Yeah.
Well, and they do a lot of good research.
They
do put out a lot of good data. I know Dr. John, you wouldn't know this, but one of my areas that I focused on in graduate school is suicide. So I know that the Trevor Project puts a lot of good data out about like LGBTQ mental health and suicide and things like that.
And there's not a ton of data on it. Like it's only been like a recently surveyed thing to even like ask youth about their gender or identity and sexual orientation. So like the more information, the better.
Totally. All right, Cindy from Brooklyn asked, I have so much respect for the LGBTQ community. I want to know how to make people feel safe, or I want to know how to make people within this community feel safe and respected. Any ideas?
That is a complex question because the answer isn't the same for everyone, you know? And so, like, for some people, making them feel safe is actually not talking about their sexual orientation because they might be in a setting where it's not okay, right? For some people, it's using their pronouns or just asking questions in a non-judgmental way. Like when someone says like they have a partner or something, you use they pronouns until you determine the gender of their partner so that you're not making any assumptions, or don't ask people, do you have a girlfriend or a boyfriend, and things like that. But yeah, that's a tough thing. I think, I don't know if this person mentioned like what they do for work. Are they in like that field?
Yeah.
Because that's something that like in healthcare, I think the way you introduce yourself is a big thing. Like I walk in and say, I'm Dr. John, my pronouns are he, him. I'm going to tell you a little about myself. And just like that immediate signal is like, okay, for so many people, even if they're not transgender, they're just like, oh, this is like a welcoming, open environment. If you work somewhere that has like a badge, putting a sticker on it or some kind of sign, or if you work at a desk job, having a flag or just something to outwardly symbol that you're an ally, I think is a really good starting point. And then just kind of following people's lead, because yeah, like making a patient feel safe. Sometimes a new patient will come in and I know they're gay. But if they don't share that with me, then I don't pry about it, because it's, if they didn't want to talk about it, then that's me keeping them safe in this space, even though like it is comfortable for them to talk to me about it, I would hope. If they're choosing not to, then that's their decision.
Those were all such great things. Another thought I had, and I would love to, obviously tell me if I'm wrong, but I think at a very basic level, just listening to the stories and the voices of members of that community, and you mentioned the term ally, having allies not center themselves in those discussions, like actually listening. I mean, we're all mental health professionals here, and like our job is to listen, but I think listening is a very powerful tool that anybody can do.
100%. Yeah. And I think in a lot of medical settings, people don't feel listened to, unfortunately. So yeah, you're totally right. Like something as simple as just listening is really powerful.
I like that. And I like how you also mentioned too that like it might not even be safe for someone to actually talk openly about, their sexual health or even just who they are as a human, just because they feel like they might be in a setting where they might out themselves or something might happen. I think that's really, really crucial for people to keep in mind. Like just because you have a friend who might be in the LGBTQ community doesn't mean you have to talk about their sexuality all the time, or out them in some way.
Right.
If you're out with them.
Right. 100%. Like where I did my training for my residency in Grand Rapids, Michigan, which is like a very conservative area. And I was definitely out in my personal life. But there were times in certain work settings when I was like, this is actually a little uncomfy for me, that I'm gonna like kind of code switch a bit and maybe not be 100% my authentic self, because I'm a little worried about what people might say or judgment that might be passed. So yeah, it's not always the same situation,
Yeah, 100%. All right, Jack from Utah, she said, precautions that men need to take to be safe when engaging in sexual activities. She also had a follow-up question as well, advice for parents with a gay son who's sexually experimenting. So anything that you could talk on that topic.
Yeah, lots of questions from Utah, which we love to hear, first of all.
Yes, exactly.
Yes.
We love it, yeah. Good observation.
Yeah. So, I mean, of course, standard protections that anyone should be taking with sexual interactions is condom use is always encouraging, going to be the best thing. I guess I don't know how old their teenager is, but I appreciate that they're sharing and talking to them. So just like nobody even if you're straight, it's like uncomfy to talk to your parents about sex. So like encouraging that conversation, and seeing whatever they do want to share. I think a really, really crucial thing is honestly having a doctor that they're comfortable talking to about, because your parent isn't your doctor, and you're not really going to talk about the percentage of times you're using condoms with your mom and the number of people that you're having sex with. Is, even if you guys are super close, I think that would be a rare thing to do. So doing your best to find someone in the area that would be able to advise them. Of course, there's things like PrEP, pre-exposure prophylaxis, which is a HIV prevention medication that a lot of men who have sex with men are on, just because condom use in men who have sex with men is much lower because there's no pregnancy risk. So that would be something that they should talk about with their doctor, and if they are a candidate for. And I would say just mainly encouraging them to have open conversations with their sexual partners about getting tested. And even like in this day and age, most people have an app for their results that they get from their doctor. And it is totally okay for you to ask to see a partner's results before you have sex with them. If you are not feeling safe about it, that is totally a thing that's okay to ask for. And I encourage my patients to have the app and to have those conversations before they have a new partner. Like, do you get tested? Are you on PrEP? If not, when's the last time that you have been tested? Ask them if this is a monogamous situation or not, because non-monogamy is way more common in the queer community as well. And those are all things that the parent might not know, and that the kid might not know as well. So great question, and we love you being there for your son.
Well, and it's interesting because, I mean, I'm not a doctor, and so I don't know, in the in-depth of healthcare, but one of the things, it was a radio station in my town. They do HIV testing every year, and for them, like, it's for sometimes, like, I guess there's one that you just finger prick. And so sometimes it's super easy for some of the STI testing to just be able to get access, rather than having to go in. Like, yes, there's other, STIs out there, but sometimes like just being able to do a finger prick test and having that sent to your home, as something so easily, accessible, that even like 10, 15, 20, 30 years ago, that didn't exist.
Absolutely.
In the slightest.
Absolutely. Because, then like PrEP is becoming way more accessible, which we love to see, because that was actually such a barrier before. That was a barrier for me just like 6 years ago when I lived in Grand Rapids. Actually, I tried to get on PrEP, and a primary care doctor who very comfortably should have been prescribing it was like, oh, that can only be managed by an HIV doctor. Like, you'll have to go see like an HIV specialist. And like, I felt so stigmatized and judged, and it was terrible. And so I'm sure, especially this person living in Utah, like might not have access to a PrEP comfortable doctor. And so there's now apps like Mister is one of the like big ones that you can do your testing like with them like through the mail. I think they like send you just like the labs to do and can arrange your prescription, which is like amazing that we have that access.
That's incredible. That's incredible. And I really love that you even brought up PrEP, because I think a lot of people within my social sphere, it's just so stigmatized, and they're like, oh my gosh, do you have to, what doctor do you go to for that? And it's like, you go to your primary care. Like, that's where you get it,
right. Most primary care doctors should be comfortable prescribing it. And if not, you should find a new primary care doctor.
Yeah. Exactly.
And like you said, like that barrier that your provider at that time had given, right, just created another barrier. And we had touched upon this kind of in our discussion earlier of like how frustrating that is. Like, I'm going to get care so that I can help myself and keep myself safe, but now I now have to go to a specialist,
literally,
and wait on their wait list just to get a medication that I can take to not only help myself, but I'm going to assume that helps the other people that I may be sexually active with.
Of course. And honestly, in this interval of time when I'm waiting to see this specialist, I could acquire HIV, and because of this barrier that you created, creating another copay to see a specialist, it was a very uncomfortable conversation, because like, I had already disclosed that I was a physician, and she was like kind of mansplaining, like, well, these medicines are very complex medications. It's not just something as simple as prescribing. And I was like, oh no, I can tell you exactly what you need to do. These are the labs that you need to order. You need to see me every 3 months. I will lay it out for you. And
That's what I'm talking about.
Yeah, like straight up. And here I am, this like 25-year-old, like, and then I could tell that she was like, well, it just doesn't, I don't have to prescribe like just because you're requesting. And I'm like, no, you don't. But like, I really need you to know that this is like a really bad thing that you're doing. And it is making me feel really stigmatized right now, which is,
that is so wild.
Unfortunate. Yeah.
Like that's not even me or any situation, but that's exhausting.
Mm-hmm.
Yeah.
Like just listen, I'm like, oh my God. To advocate just for simply a medication, like that's like, and I can't imagine like, again, any people out there who might be listening or know someone, like just those barriers and just how exhausting it is to keep coming up against them.
Yeah. And most people wouldn't have like the confidence and knowledge to do that and say that, you know, so most people would be like, oh, okay, like whatever you say, you know, like you're the doctor. And so it was so frustrating to me. And so it became like kind of my like side project in residency to do like queer health competency in the system, because I was like, this is such a negative thing, and I can't believe that like this is still how things are at this day and age. And Michigan was like fairly liberal, like I mean there's like a decent queer population, but it was like, so I can't imagine what it's like in places like North Dakota and things, you know, like it would be really tough.
Oh my gosh, yeah. Crazy. Okay, Trina from New York asked, how do I go about finding a provider, a doctor, or a mental health professional who's educated in LGBTQ plus experiences?
Yeah, that is great. That's something I try to recycle posting about this like at least once a year, because it's a really common question. The main database that I usually direct people to is the GLMA website. And it's a website that any queer provider or even ally can register on to say that they are like a safe space. And then it goes by zip code. So it's in all 50 states, I'm pretty sure. And you can just type in your zip code, and it's for like not only primary care providers, but therapists, dentists, even a few different like specialties of things. And I think it's a really great resource. There's also one called Outcare, that's only in a few states, but that I'm registered on as well. So those are the two main ones. And then I usually encourage people to like look at their personal website, like when you see them, because there should be something there about like that they are competent in queer health. Because I mean, some people, you want to be an ally, but like you might not know like what you're doing, and especially things like prescribing hormones for like transgender patients. Like that's something that like not everybody is going to be well versed on, and they may not be able to provide the services. So kind of depending on exactly what you're looking for from your provider, kind of vetting them through their website ahead of time, or even calling the office to be like, is this something that you guys do? Because it would suck to go somewhere and not be able to get the treatment that you're looking for.
Yeah, well, and I didn't know about that. Is it GLMA website?
GLMA.org, yeah.
Yeah, so I didn't even know about that, because I was like, oh, for mental health, you just go to Psychology Today. There's a button you can click. And then,
so
again,
limiting.
You should dig into it for sure and, like, you know, vet it and stuff. But I also think there's also power in word of mouth. So if 100%. You have other friends who are in the LGBTQ plus community, asking them, like, who do you see? Mm-hmm. Who have you seen? Like, who do you see that you like, and who have you seen that you're like, absolutely not?
100%. That's huge. Because so I actually, like, I don't know if you guys are familiar with Chicago, but like we have Boys Town, which is like the queerest neighborhood in the country. And my clinic is nowhere near that. It's like South Side, like super removed. So I actually like don't expect to have a big queer population. But just from registering on those websites and then word of mouth, like I now have like a decent chunk of patients of people who come to see me like because of word of mouth, which is always nice. I love when someone comes in and they're like, my friend told me like you're really great, and I'm like, oh, thank you so much.
That is so incredible.
Give me more compliments, thank you.
Literally. Yeah, I do. I was telling them before I do gender affirming surgery evaluations, and I can't tell you how many people will come to me just after their friends have did an evaluation, and stuff like that. It's just really incredible with word of mouth.
Biggest compliment ever.
It is like, it makes me cry literally.
That's what I was about to say.
Is what you're saying.
That's what I was going to say. Like for someone to feel safe enough to then go and tell their friend, hey, this is a safe space, or what I have at least constituted as a safe space. Like, again, like you said, like that's such a huge compliment, because I think it then says I'm doing something right.
Absolutely.
All right. Anonymous, we don't know who they are, asked, do I have to tell my doctor that I'm gay, I'm not out, and I don't want my family to know? I don't know how old they are either, by the way.
Yeah. You definitely do not. You don't have to tell your doctor anything you don't want to tell your doctor, right? Your appointments are dictated by your goals, and not every provider is as respectful as that, because we have an agenda, of course, that we want to accomplish. There's certain like health maintenance things that we think that you should always do, but none of those things are mandatory for you. And so if it's not comfortable for you to share your sexual practices with your provider, then you definitely don't have to. Of course, I would want you to be getting the right testing that you need to be getting if you are sexually active. And so that kind of creates a bit of a barrier. If you're not going to share that you're gay, then your provider definitely wouldn't know that you're having anal sex. And so that could be something that is missed in terms of your testing, because a lot of times a standard, even if they offered you STI testing, that would consist of urine and blood work, and it would not consist of rectal swab, oral swab. And so if you aren't going to share that, then it would be something that you would at least need to know what testing that you need to do. So it puts the onus a little bit on yourself of knowing, these are my sex practices and this is the stuff that I need to request. If you're not overtly saying that, like, I am a man who has sex with men. If that person is a child, though, and their parent has access to their record, that kind of complicates things a little bit. But you can go for like STI testing and keep things anonymous and not to be on your insurance if that is necessary. That is a thing that you can do.
Yeah, I think it echoes what you said before about finding a provider will really see you, and create that safe space. I love that. Okay, Amy asked, does substance abuse and addiction impact does substance abuse and addiction impact LGBTQ individuals differently?
It does. There's, like we said, there's not a ton of research on this kind of stuff, but I think, even logically, just thinking about that, LGBTQ individuals keep this terrible secret for a really big chunk of their lives, and don't trust sharing people and live in fear that people are going to judge them, and we all know keeping secrets bottled up inside is not a healthy thing to do. And so, there is definitely research that shows that there are higher rates of most mental health conditions in queer populations, as well as substance use disorders. And it is really, really unfortunate. And the more that we talk about it, the better that we can make it, and try to make it okay for people to come out at earlier ages. I love to see how many more queer youth there are now than when I was in high school, and so hopefully that's something that will improve with time. But we definitely know that they're disproportionately affected by it, and they also struggle to find people that they feel comfortable getting care for those things about as well. You guys all are mental health providers. I'm sure a lot of people don't feel comfortable sharing that type of stuff, so.
Totally. Yeah, we were even talking about that earlier. And I was I was sharing my own personal experience. I was like, if I was able to come out earlier, oh my gosh, that would have been great, or just people in general, having these conversations earlier, and having, sex education that has you in mind, I think is so important 100%. At young ages too.
Yeah. Coming out earlier could really change the trajectory of your life, without a doubt. And finding providers that you're comfortable talking to. When I don't know if this is a bad thing that if you guys will judge me about. When I first started seeing a therapist, I started seeing 3 therapists at the same time, of like different.
Yo, wait, hold up.
I like
I'm not
that.
I'm not judging, but
That's sample.
That's a lot of coffee there.
that is you were trying to heal so fast. Like
He was like, can I put this therapy on X Games mode? Thanks.
So I specifically found people with different walks of life and different levels of education, because I wasn't sure exactly the approach that I was going to need. And I was like set in my head, like, I'm positive that I need a gay man. And so like I had a gay man as one of the options. And then I had this like older woman, like psychologist, PhD, who I ended up, she before I started thought she would be the less likely like to connect with. And then I ended up really liking her. So I did 2 sessions with all of them, and then like told the other ones like, so I've actually been kind of like looking for like the best fit, and
I'm cheating on you. Sorry.
I think we need to see other people things.
Yeah.
I love that.
I don't think that's like generally recommended, but it really made a difference for me. And then I like was so confident, like I feel so comfortable talking to this woman, and like already by session 2, like we're like making progress and stuff. And it wasn't the same with the other people. And so like it just goes to show that like finding someone that you really connect with like makes all the difference.
I love it.
That might be the trend. I don't know.
I seriously, I mean,
it makes sense.
You did a case study and you were successful. So I mean,
I was so busy. Like I was like, oh, I have therapy again. Oh my God.
I'm just sitting here like, wow, $25 copay, $25 copay, $25 copay.
In my defense, I was getting divorced, so it was like peak crisis mode, and like really needed to like talk about some stuff. So yeah, you're right. It was a little bit of X Games mode of like this needs to happen quickly, and I really need to like be making progress here. Yeah,
I absolutely love that, and
I love it.
Yeah. I'm like rethinking my life choices now. I feel like I should have done that. Like,
Damn.
Oh my gosh. Okay. Anonymous from New York asked, what do I do if my doctor is not listening to me? I'm trans and they use the wrong pronouns and dead name.
First of all, I'm sorry that you're having that experience, because that is really rough. I mean, beyond just simply correcting them, I'm sure it is exhausting if you have already done that a number of times. It honestly may be a systems issue, and this is something that like a lot of organizations like don't have built into their EMR to have like preferred name and pronouns, or even on their intake form, and so your provider, who may just not be that personable with their patients, doesn't remember that this is the name that you go by. There's like something called a sticky note in my EMR that like I have like, this is their dog's name and blah blah blah, and this is like where they were born and whatnot, because like that's important, right? So I have everyone's, like every person, if I meet a 60-year-old straight man whose name is Doug, when I introduce myself, I say, what name do you like to be called? And so many times people are like, well, my name, and I'm like, and what name is that? You know, so I think that's my standard phrasing with everyone. And then I write on their sticky note, goes by Doug. You know, like every person I ask that. So most people obviously don't do that, and they see the name in the chart and they call you Rabon. So I mean, I don't know how many times you can say like, actually, this is my name and these are my pronouns, and they're really not getting through to them, then like maybe it's probably not the most comfy environment for you to seek healthcare. I know it's like a privileged thing to say that you like finding care elsewhere, because that might not be an option for you. But yeah, I mean, maybe starting off your visit with being like, hey, just a reminder that like these are my pronouns and this is my name. Like, I think setting the stage for your appointment is like a really big thing. Like one of my like most viral posts is about like setting the stage about like weight, because that's like a huge issue with people going to appointments, and just saying like, hey, like I know you probably are going to want to talk about my weight, but I don't really want to talk about that today. And so I'm here for this. And so like, that's an important reminder, is like you have the power of your appointment, and you can control the agenda as much as you want to. So it takes confidence, and it's hard, especially with like a well-educated person that might seem like they're judging you a little bit, but do your best. I
also like to add on that, like I also remind clients, like you just said, like that doctor's well educated, right? They have their doctorate degree, all of that. But like, you're the expert in your life and your experience. So it's like, yes, you might have the knowledge of whatever the like cardiologist, primary, whatever you're going and seeing them for, but at the end of the day, you are the one who's the expert in you, and needing to remind yourself about that.
Absolutely, 100%. And I say that all the time. This kind of goes back to me saying, like, I'm not the perfect doctor for every patient, because, like, I very frequently say, like, well, what do you think is going on? Like, is there something that you think is, like, the problem? And, like, I love asking that, because, like, most of the time, our generation, at least, like, has something that they've read about or that they think might be going on. And if you can just come out and tell me that, then we can look into that, you know? But sometimes I phrase that question to different people, and they're like, well, why would you ask me? Like, you're the doctor, you tell me what to do. And that's like, I'm like, okay, well, I kind of like to involve you in your care. I'm sorry that's not being received as a good thing. But yeah, like, you're right. Like, you know yourself better than anyone else. Like, I see you 2-3 times a year. Like, I don't know everything about you. And so if you think something's going on, I would love to hear about it.
I love that. Oh, I love that. I love collaborative care. We love that. Okay, last question. Beth from Kansas. Challenges and disparities faced by LGBTQ plus individuals in rural areas.
Whew, that's just
I know. That's a loaded one.
It really is. Yeah. Because, I mean, it starts with just genuinely being able to find a doctor that knows anything about your health and what your needs are. And I hate to say this, but, like, honestly, it somewhat puts the onus on you to educate yourself about what your unique medical needs are. And sometimes educating your provider on that, like, just like I did in my prep visit. If your provider isn't familiar with the best way to care for you, then you kind of need to, unfortunately, find that out for yourself and find ways to advocate for that and the things that you need. Obviously, the ideal scenario would be finding someone that you could either travel to get care that would be more comfy, or doing telemedicine with someone who offers that, but that takes money and insurance and things that you might not have access to. So yeah, otherwise, using online resources, like following, there's tons of doctors who post about transgender medicine and things like that, who would be reliable resources that can explain to you the different ways of hormones and things like that. So yeah, and unfortunately, sometimes you got to put yourself in the driver's seat.
I hate that we're already at the end. Like, I have learned so much from you, Dr. John. It just, like, flew by. Like, that just flew by. I appreciate your expertise, your insights, joining us this evening. And thank you, everyone listening, for joining for today's episode. If you like this episode, please share it with someone who you think will enjoy it. Please rate, review, subscribe to the podcast. Go follow That Gay Doctor on social media, TikTok, Instagram. Are you anywhere else?
No, just TikTok and Instagram.
Okay. Just want to make sure. Well, yeah, the two best ones. We'll link your socials in the show notes as well. And as always, we leave you with a reflection question. So in honor of Pride Month, we leave you with this question. What is one thing you will do this month to celebrate, advocate for, or support the LGBTQ plus community? So head over to our Instagram, answer the reflection question, and we will see you next week in group therapy. Bye.
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 Bye, y'all.